Immigrating to a new country can be challenging. Often it can involve a long geographic journey, travel through unknown places and cultures, be physically demanding, and produce anxiety about work, residence, and fitting into your new culture. These challenges can take a toll on a person's health. Yet, paradoxically, Hispanic immigrants are statistically healthier when they arrive in the United States than after having lived here for a lengthier period of time. This phenomenon represents a danger to the well-being of many young adult Latino immigrants. It also creates challenges for the health system and community that surrounds them. This problem is where Duke University School of Nursing's Dr. Rosa Gonzalez-Guarda hopes to gain insights and present solutions using a $3.4 million grant awarded from the National Institute on Minority Health and Health Disparities. Dr. Gonzalez-Guarda's grant will use trained DUSON students and other community members to research stress and resilience in the Durham area Hispanic immigrant population.
What we're aiming to do is to take a look at the influence that acculturation-related stressors, so stress related to acculturating to the United States, and the influence of resilience factors such as family support, and the impact that has on multiple health outcomes among Latino immigrants in the United States. We're specifically focusing on young adult Latino immigrants, and the health outcomes that we're looking at range from a series of risk behaviors such as substance abuse and intimate partner violence and risky sexual behaviors to mental health outcomes such as depression and anxiety. And then we're also looking at stress biomarkers, so the physiological response to stress in the body.
Dr. Gonzalez-Guarda says that acculturation stress has the ability to affect physiological outcomes, and that the stress is both unique and not well understood.
The real big goal of this study is really to help us understand what the role that stress and resilience has on health among Latino immigrants. We know from work with other populations that stress is very detrimental, but this is really the first study that looks at the influence of acculturation stress on physiological health consequences. And so we're hoping to learn about what type of stress is most detrimental and what type of resilience factors are most helpful in the health of Latino immigrants, so that we can develop interventions that target those specific most important influences on health in this population.
Gonzalez-Guarda is working with a dynamic team that includes experts in culturally specific measurement and approaches, community leaders, and a bench scientist with expertise in measuring stress biomarkers. Co-investigators include experts from the Duke University School of Nursing, Dr. Julia Walker and Dr. Irene Felsman, and community partners like Pilar Rocha Goldberg from El Centro Hispano. Also, by participating in the gathering of research and its interpretation, she says the study plays an important role for DUSON students who are learning about how that research impacts healthcare delivery. Dr. Gonzalez-Guarda also says it's a great way to get to know the community.
They're learning more about the population needs as well as the great strengths that the Latino immigrant have. A lot of times we, in our education and formation, we focus a lot on things that are wrong with communities, and one of the things I'm hoping they'll be able to uncover here is all the good things that this community has that contributes to their health. So that's one of the things. I think the other thing is really learning about the powerful role that research has in terms of informing nursing practice and public health, and the way that it could really inform evidence-based practices.
We hope you will check back and learn more about the Ser Hispano study in the future. We will be following the study closely because it is one of the many ways Duke University School of Nursing is working to apply research, knowledge, and on-the-ground care to reduce health disparities, create a better, more inclusive healthcare system for our future.